Next, we're going to simplify the coronary arteries. So I've started by drawing a heart shape just to make this more simple. And we're going to start by drawing the two coronary ostia, which arise from the sinuses of Valsalva, which is also known as the aortic sinus, which is just above the aortic valve. So you've got the left ventricle into the aorta. So this is the aortic valve. So left main stem comes from this ostia here. So that's left main stem. The left main stem divides into the left anterior descending artery, or also known as the left interventricular artery. So this comes down here, down the left ventricle, and then this has the first diagonal branch and some other diagonal branches that come off it. It also divides into the circumflex, which weaves around and then goes around the back of the heart, and that's the circumflex artery. The posterior descending artery, which we're going to draw from the right coronary artery, is from there in 85% of people, and that makes you right dominant. But in 15% of people, it can come from the circumflex artery. The left marginal artery branches from the circumflex. So that's this one here, left marginal artery. So the right coronary main stem comes from the right ostia, and that one divides into your acute marginal artery, which is here. And then in 85% of people, it becomes a posterior descending, which goes down the posterior of the right ventricle. So that's your posterior descending artery. So that's what makes you right dominant. And then the sinoatrial artery arises from the right coronary artery in 60% of the population. And that's the main one that supplies the sinoatrial node. Now, if you look at an angiogram, then you normally look at it from the right lateral, which you can see in my main drawing here, is like looking at it from this side. So in an angio, you'd get a kind of a 2D image like this, and across the top you have the left main stem, which shows you the LAD, and then you'll see the first diagonal coming down, and there's circumflex coming down. So if you're looking at an angiogram, that's the kind of image you see, because you're looking at the heart from this side.